Hello everyone, I am Dr. Kabil, radiologist from India. Today I am just going to discuss how to approach a chest X-ray. So why is it so important is only when you see chest X-ray details in a stepwise manner, you will not miss some abnormal findings. Otherwise, if you just see it in a random way, you will tend to miss findings very frequently. So here I am showing you a chest X-ray which is taken in a PA view. So in any chest X-ray, first just look at the demographic details, that is the name of the patient, age, sex, and the date of the X-ray which has been taken. And then the second very important thing is just have a look at the marker to see whether it is right or left side and correlate with the patient's clinical details also. And then in the X-ray you have to have an idea whether it is sufficient or adequately taken X-ray, that is regarding the quality of the X-ray. So here it is a chest X-ray which is actually covering from the level of D1 spine to the subdiaphragmatic region, and it has covered the adequate area. And regarding the rotation, that is centering of the patient, you have to see the interspinous line in midline and medial end of clavicle on both sides. So the distance between the medial end of the clavicle and the interspinous line should be equal on both sides. Otherwise it indicates there is a rotation rotation of the patient while taking the X-ray. So why is it so important is it could cause some abnormal shape or configuration or size of the normal structure, so it could cause some confusion while interpreting. And then the next important thing is to look the exposure level. So if it is adequately exposed, all the details will be available for interpretation. Once if it is underexposed, the film it will become white, and if it is hyper exposed, it will become totally dark. So there will be very less information to interpret in a chest X-ray. And while taking an X-ray, there should be very good inspiratory effort so that lungs got expanded. And while evaluating, you have to check the both sides because both sides are symmetrical, and you have to compare both sides, and you need to comment upon both side findings. Okay, while dealing with X-ray, chest X-ray, you have to go in a stepwise manner, that is from center to the periphery. So first initially I am looking at trachea, which is actually in midline, which is air-filled lumen seen as lucency, and it is branching into two bronchi. And then the superior mediastinum, and it is predominantly made up of the aortic arch, and the descending aorta margin will be seen along the thoracic spine on left side. And just adjacent to the trachea there is something called paratracheal stripe, and the width of it should be less than 3 mm. Once if it is more, then it could be because of some lymphadenopathy or any neck mass lying over there. And the trachea should be in midline, or it could be slightly deviated towards right side, but there should not be significant deviation, which could happen in case of any neck mass or thyroid goiter or thyroid mass. And superior mediastinum could be widened in case of any superior mediastinal mass, or it could happen in case of any atherosclerotic unfolding of aorta in an elderly patient. And regarding the cardia, you have to see the margins of the cardia. It has to be very sharp, since if any pathology is abutting the heart, then there could be some blurring of the heart margins. And also regarding the size of the heart, there is something called cardiac thoracic ratio, that is the heart diameter should not be 50% of the thoracic diameter. And then you need to look both hilums. In hilum there are few details you have to see, like the opacity of the hilum, the density of the hilum, the shape of the hilum, and also the location of the hilum. Left hilum can be in a slightly higher position when compared to right hilum, but there should not be significant pull or significant portion, I mean right hilum in higher level, that all could happen in case of abnormalities like fibrosis or any mass. And then you have to see the cardiophrenic angle and the costophrenic angle on both sides. Costophrenic angle could be blunted because of pleural effusion, and any mass lying in the cardiophrenic angle could obliterate this angle. And also you have to look at the diaphragm. In normal cases, right hemidiaphragm is at slightly higher level and left is at a lower level, and this difference could be 3 centimeter or 2 intercostal space. And the reason why the left hemidiaphragm is at lower level is it because of the weight pushing the cardiac weight actually pushing the hemidiaphragm downwards on the left side. And regarding the lung fields, we can divide it into 3 zones. The first 2 intercostal space as upper zone, and the next 4 as mid zone, and the rest as lower zone. So whenever you are seeing some abnormal finding like focal lesion like carcinoma or any nodule, you need to mention specifically on which zone it is actually present. And regarding the inspiratory effort, in a good inspiratory effort film, you should be able to see the 6 anterior ribs and 8 posterior ribs. Actually anterior ribs will be seen slightly in oblique manner, and posterior ribs will be placed in a horizontal manner. So in poor respiratory effort, there will be less number of ribs will be seen along the lung fields, and in cases like emphysema COPD, you will be able to see more number of ribs in the lung fields. And you need to see the bony cage, that is primarily made up of ribs, clavicle, and thoracic spine. Thoracic spine will be very faintly seen in a adequately exposed film, but still you need to see the see whether any lytic or any bubbly expansor lesion arising from the thoracic spine. And you have to check for any lytic lesion or any expansor lesion arising from the rib, or in case of trauma there could be fracture, and in conditions like coarctation there could be notching will be seen in the undersurface of the ribs. And also you have to see the presence or absence of clavicle and any lesions in the clavicle. Then you have to go to the periphery soft tissue. You have to see whether any soft tissue mass or any calcification, like as if in case of hemangiomas or surgical emphysema, that is air tracking under the subcutaneous fat plane in case of trauma. And in any X-ray film, you have to check the whole, I mean check the film as a whole. Like in chest X-ray, you have to see even the peripheral bone which has been exposed. So in case of in case of trauma, there could be some fracture in the humerus, or case of any cancer patient, there could be some lytic metastatic lesions which you also need to pick. And then there are few regions which you need to focus more, like apical regions, where there could be apical pleural thickening or pancreas tumor which could cause rib destruction at the apex. And you have to focus more on the hilum. It could be enlarged because of some lymphadenopathy or any mass lying over there. And the retrocardiac space, it is very important, and it is very easy to miss if at all if there is any consolidation lying in the posterior segments of the lung. So there could be some air bronchograms, unless otherwise you focus more, you tend to miss. And the subdiaphragmatic region is also very important. In case of any pneumoperitoneum, there could be some gas under diaphragm, that is gas under right hemidiaphragm, and the fundal gas will be seen under the left hemidiaphragm. So in case of suspected hollow viscous perforation, the initial investigation to be done is chest X-ray in erect position to look for air under right hemidiaphragm. So small recap, you need to see structures in a stepwise manner from the center to periphery. First you have to see the trachea and superior mediastinum, cardia, and then cardiophrenic, costophrenic angles, diaphragm, and lung fields, peripheral bones, soft tissues, and the peripheral bones, and then the apical regions, hilum, retrocardiac area, and the subdiaphragmatic area. So this is how you need to check all the structures in a chest X-ray. So it is very difficult to miss any abnormal finding. Thank you for your patient listening, and in the subsequent session we can see how abnormal pathologies will be seen in chest X-ray. Thank you.